Aspirin is commonly used to reduce fever and relieve mild to moderate pain from conditions such as muscle aches, toothaches, common cold, and headaches. It can also help reduce pain and swelling in conditions like arthritis. Aspirin is known as a salicylate and a nonsteroidal anti-inflammatory drug, NSAID, which means it works by blocking certain natural substances in your body to reduce pain and swelling. It's important to consult your doctor before giving aspirin to a child younger than 12 years old, and always keep all medications out of reach of children, as aspirin is a common cause of poisoning in children. Your doctor may also recommend taking a low dose of aspirin to prevent blood clots, which can reduce the risk of stroke and heart attack. If you've recently had surgery on clogged arteries, such as bypass surgery or coronary stent, your doctor may direct you to use aspirin in low doses as a blood thinner to prevent blood clots. Aspirin prevents blood clots by stopping certain blood cells, platelets, from clumping together. Remember to always follow your doctor's instructions when taking aspirin. If you're using aspirin for self-treatment, make sure to follow the directions on the product package. If you have any questions, it's important to ask your doctor or pharmacist for advice. If your doctor has prescribed this medication for you, be sure to take it exactly as directed. You can chew the tablet thoroughly before swallowing, or you can crush it or swallow it whole. If you experience stomach upset, you can take the medication with food or milk. The dosage and duration of treatment will depend on your medical condition and how you respond to the treatment. Make sure to read the product label to find out how many tablets you can take in a 24-hour period, and how long you can self-treat before seeking medical advice. It's important not to take more medication or take it for longer than recommended unless directed by your doctor. Use the smallest effective dose and consult your doctor or pharmacist if you have any questions. If you're using this medication to treat a headache, seek medical help right away if you experience trouble speaking, weakness on one side of the body, or sudden vision changes. It's also important to consult a doctor or pharmacist if you have headaches caused by head injury, coughing, or bending, or if you have a headache with severe vomiting, fever, and stiff neck. If you're using this medication as needed, remember that pain medications work best if they are used at the first signs of pain. Waiting until the pain has worsened may result in the medicine not working as well. Do not use this medication for self-treatment of pain for longer than 10 days, and do not use it to self-treat a fever that lasts longer than 3 days. In these cases, consult a doctor because you may have a more serious condition. Tell your doctor promptly if you develop ringing in the ears or difficulty hearing. If your condition lasts or gets worse, or if you think you may have a serious medical problem, it's important to tell your doctor promptly. If you experience upset stomach or heartburn while taking aspirin, it's important to let your doctor or pharmacist know. However, many people using this medication do not have serious side effects. It's important to tell your doctor right away if you experience severe nausea or vomiting, easy bruising or bleeding, difficulty hearing, ringing in the ears, signs of kidney problems, unexplained tiredness, dizziness, dark urine, or yellowing of the eyes or skin. Aspirin may rarely cause serious bleeding from the stomach, intestines, or other areas of the body. If you notice severe or persistent stomach pain, black or tarry stools, vomit that looks like coffee grounds, trouble speaking, weakness on one side of the body, sudden changes in vision, or sudden severe headache, it's important to seek medical help right away. While a serious allergic reaction to aspirin is rare, it's important to get medical help immediately if you experience symptoms such as fever, swollen lymph nodes, rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. Before taking aspirin, it is important to check with your doctor or pharmacist if you are allergic to it or other similar medications. This is especially important if you have any other allergies or health conditions such as bleeding disorders, kidney or liver disease, stomach problems, asthma, gout, or certain enzyme deficiencies. It's also important to limit alcohol and stop smoking while taking aspirin to reduce the risk of stomach bleeding. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications and herbal products you are currently using. Children and teenagers under 18 years old should not take aspirin if they have certain illnesses, as it may increase the risk of a rare but serious illness called Reye's syndrome. Older adults may be more sensitive to the side effects of aspirin, especially stomach/intestinal bleeding and ulcers. During pregnancy, aspirin should only be used when clearly needed, and it is not recommended for treating pain or fever. In some cases, low-dose aspirin may be used to prevent certain conditions, but it's important to discuss this with your doctor. Aspirin can also pass into breast milk, so it's important to discuss the use of aspirin while breastfeeding with your doctor. It's important to be aware of potential drug interactions when taking aspirin. Make sure to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Some products that may interact with aspirin include acetazolamide, other blood thinners like warfarin, corticosteroids like prednisone, herbal medications like ginkgo biloba, and others. Before using aspirin, consult your doctor if you have recently received certain live vaccines. Also, be sure to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers known as NSAIDs. This is important to prevent an overdose of aspirin. Daily use of NSAIDs like ibuprofen may decrease aspirin's ability to prevent heart attack or stroke. If you are taking low-dose aspirin for prevention, consult your doctor or pharmacist for more details and to discuss other possible treatments for your pain or fever. It's also important to be aware that aspirin may interfere with certain lab tests, potentially causing false results. Make sure that lab personnel and all your doctors know that you are using this medication. If you suspect an overdose and the person is experiencing severe symptoms such as passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include burning pain in the throat or stomach, confusion, changes in mental/mood, fainting, weakness, ringing in the ears, fever, rapid breathing, changes in urine output, seizures, or loss of consciousness. If you take aspirin regularly or in high doses, your doctor may want to do some lab or medical tests to check your liver and kidney function, blood count, and salicylate level. It's important to attend all your medical and lab appointments and consult with your doctor for more information. There are various types of aspirin products available, some with special coatings and others that are long-acting. It's best to ask your doctor or pharmacist to recommend the most suitable product for your needs. If your doctor has prescribed a regular schedule for taking aspirin and you happen to miss a dose, take it as soon as you remember. However, if it's close to the time for your next dose, then it's best to just skip the missed dose and take the next one at the regular time. It is important not to take a double dose to make up for the missed one. When it comes to storing aspirin, make sure to keep it at room temperature and away from moisture and light. Different brands may have different storage needs, so it's important to check the product package or ask your pharmacist for specific instructions. Avoid storing it in the bathroom and do not use any aspirin product that has a strong vinegar-like smell. Keep all medications out of reach of children and pets. When it comes to getting rid of expired or no longer needed aspirin, it's important to properly discard it. Do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the best way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.